PCOS is one of the most common causes of female infertility. This is what you should be aware of if you're trying to get pregnant this year. To tell if you have PCOS, you use the Rotterdam criteria. So there are 4 things on this list, and you need 2 of them in order to be diagnosed with PCOS. I also want you to know and remember that PCOS is a big range. All right, so some people have more severe PCOS that typically present with most of these symptoms, and some people have a lot more mild PCOS that presents with at least 2 of these symptoms, but you don't need to have all of them in order to have this diagnosis. This diagnosis, it is also so important to me that you remember, is not a life sentence, it's just information. When you know what you have, when we can work with your body, when we can understand what it needs, we can help you effectively. For the 4 Rotterdam criteria, number 1, we have multiple cysts on our ovaries that are seen on ultrasound. Number 2, we have oligomenorrhea or inconsistent cycles. This means that they can be infrequent or quite long, so over 35 days. Number 3 and 4 are both associated with hyperandrogenism, so higher levels of those more male-dominant hormones. So we have clinical hyperandrogenism and biochemical hyperandrogenism, big word. Clinical means things that we can see. So again, that more male-dominant pattern hair growth or acne, particularly we usually see this on the jawline. And biochemical means that we can see on your blood work that you have higher levels of testosterone and DHEA. Now, what's actually happening in the background with our hormones that contribute to all these PCOS symptoms? So we had some comments saying that their LH is always high when they're testing, so they don't know when they're ovulating. Yes, that is true. So we're looking at this yellow line here, right? Without PCOS, we see that good peak of that LH. When we have that LH spike, that triggers ovulation in our body. With PCOS, we see that LH remaining high. We don't see that peak, so our body doesn't get that signal to ovulate. Next up here, we are looking at this green line. This green line represents our androgens, or those more male-dominant hormones. So we see without PCOS, they're appropriately in line with our other hormones. When we have PCOS, they are higher and higher than our other hormones. The next thing I want you to take a look at here is this purple line, and this is your progesterone. We see and we've learned from our past hormone video that after ovulation, we see that nice increase in progesterone. That's where that's coming from. And here we see barely an increase in the progesterone there because we did not ovulate, and this leads to low progesterone. The last thing I want you to take a look at here is our follicles. So we see here, without PCOS, we have that follicle growing, maturing, ovulating, and then turning into that corpus luteum that's producing our good progesterone. When we see over here with PCOS, we have multiple follicles. None of them are really coming to maturation, and they are not ovulating, not creating that corpus luteum, so we're not getting our progesterone from them. I'm Dr. Kira. I'm a naturopathic doctor and a registered kinesiologist, both board certified in Ontario. Comment your questions for me below.